Coronavirus 2019, abbreviated COVID-19, also known as acute respiratory disease associated with the emerging coronavirus 2019, is an animal infection septic disease of origin caused by the coronavirus 2 associated with severe acute respiratory syndrome SARS-CoV-2. The emerging virus was first detected in Wuhan, China in 2019, and has spread around the world since then, causing the global pandemic 2019 to 2020 corona pandemic. Common symptoms of illness include fever, cough, and shortness of breath, while muscle aches, production of sputum and sore throat are not common symptoms. While most infections follow a benign course with few symptoms, the number of them develop into more severe forms such as severe pneumonia and multiple organ dysfunction. The ratio of the number of deaths to the number of diagnosed infections is estimated at 3.4%, but varies according to age and other diseases. As of May 12, 2020, more than 4.23 million cases have been reported in 187 countries and territories, resulting in over 289,000 deaths and more than 1.48 million people recovering. While most of the affected cases suffer from mild symptoms, people with respiratory distress syndrome (RDS) may suffer from a number of organ failure, septic shock, and blood clots. The time between exposure to the virus and the onset of symptoms ranges from 2 to 14 days, with an average of 5 days. The virus usually spreads between people during close contact, often through small drops of droplets that are produced by coughing, sneezing, and speaking. These drops usually fall to the ground or to the surface, rather than traveling over the air for long distances. In less common cases, some people may become ill by touching contaminated surfaces and then touching their face. The virus is more susceptible to infection during the first 3 days after symptoms appear. Although infection can occur before these symptoms appear and from people who do not have symptoms of the disease. In addition, it is recommended that you use a face cover for those who suspect they have the virus and who care for them. The facial coverage recommendations that people use are incompatible with the recommendation of some authorities to them, some against them, and others advise them to use them. There is limited evidence of or against the use of masks, medical or other, by healthy individuals in our community. On May 1, 2020, the United States granted an emergency use license for antivirals designers to people hospitalized due to their severe infection with COVID-19. The infection is usually transmitted from person to person with respiratory droplets caused by coughing or sneezing. The time between exposure to the virus and the onset of symptoms ranges from 2 to 14 days, with an average of 5 days. The standard diagnostic method is a serial polymerase reaction of reverse transcription on a swab taken from the nasopharynx or throat. Infection can also be diagnosed by combining symptoms and risk factors with a computerized tomography of the chest that shows signs of pneumonia. Measures to prevent infection include frequent hand washing and social exclusion, maintaining adequate distance between individuals, and avoiding touching the face. Medical masks are recommended for those suspected of carrying the virus and for the people caring for them, while the common people are not advised to wear them. There is still no effective vaccine or viral treatment against COVID-19, and management efforts are focused on symptomatic treatment and support for vital functions. Isolation and experimental measures. The World Health Organization has declared the 2019-20 corona outbreak a global pandemic and a public health emergency of international concern. Evidence of local spread of the disease was found in the 6 regions